When we talk about taking care of a patient, we have to talk about taking care of the whole patient. It doesn't stop at their neck. There's just so much more to how we manage certain health issues. It has to be comprehensive, and that starts with making sure that their mental health is taken care of.
We use the term mental health, behavioral health. It's really about brain health. It's kind of like we're looking at a heart. We call that cardiovascular disease or cardiac health or congenital heart defects. It's related to an organ, and we treat it that way. We don't blame people for having heart condition or heart problems. We look at what is going on with that organ and how is the body helping it or hurting it, and we do a systems approach to it. We have to do the same thing with our brain.
Most people struggle with anxiety and depression, and it oftentimes starts with the simple things. An overburdened life, financial strain, issues with health, issues with pain that all impact mental and behavioral health. And if we can start there by having as a healthcare team and as a community an awareness that there's a mental and behavioral health component to almost everything we go through.
My biggest thing is with pediatrics, because it is primary care, mental wellness really is something that should be more of a preventative mindset and maintenance mindset. And I think that it would be better for everyone if we could do and focus on it in that way. I think a lot of families feel like they're a bother to their pediatrician to bring up concerns, and really you're never a bother. If anything is bothering your child or your family structure, you really need to reach out to us because that's what we're here for.
So 1 in 5 women will experience a perinatal mental health issue. Women do a really good job of hiding this one. A lot of times these are women that still are going to PTA meetings, or they're getting dressed and putting on makeup and going into their doctor's office for their 6-week follow-up, and they look like everything's fine and they can smile and tell you everything's fine, but internally they're feeling pretty terrible. So I think it's always really important just to ask the right questions.
Moms really just need a break sometimes. They need that opportunity to get outside in the sunshine. They need a nap. They need someone who's just gonna say, how are you doing with this? It's very easy to automatically assume that becoming a mother or breastfeeding or just sharing that experience is gonna be very easy. It's not all the time. And some women struggle with different aspects of motherhood and should have the opportunity to voice that.
It can take medicine, it can take exercise, it can take counseling, social work, it takes community, family, friends, all of those things to address what's going on with the brain, just like the heart.